The Committee of the Whole is called to order for Bill Number 255-35 COR as amended by the Committee on Public Accountability, Human Resources, and the Guam Build-Up. Manana Sizuis to all my colleagues. Bill 255-35 COR is an act to amend Sections 4301A and C9 of Article 3, Chapter 4, Title 4, Guam Code Annotated, relative to allowing choice for subscribers that participate in the Government of Guam health insurance contract. I'd like to introduce my panel guest for attending this Committee of the Whole, Mr. Ed Byrne from the Department of Administration. Thank you very much for joining us. Colleagues, I will share some of the rules of engagement for this morning. Questions for the panel will be asked in 2 rounds. Each senator will have no more than 5 minutes time limit. I will only entertain amendments that were submitted, and amendments must be submitted in writing or via email to the clerk and to the legal counsel before the motion to amend is made on the floor. So if an amendment is to be made, I will ask the clerk if the amendment is already uploaded. Okay? I will also note to each of my colleagues that the AV team has asked us to please speak directly into the mic when your mic is on, because so that you will not be muffled and that they could hear you clearly. So that was a request from audio to make sure that every colleague is heard clearly, that they speak into the mic. Thank you very much. Before I give the opportunity for the author of the sponsor of the legislation to speak, I did have a request. Senator Moreland, I will request you for a motion to recuse.
Thank you, Madam Chair. Yes, kindly request that I be recused from this.
On a motion.
On a motion, please. Kindly request a motion that I be recused from this committee as a whole. Thank you.
From speaking on the issue and voting.
Yes, Madam Chair,
Yes.
from speaking on the issue and voting on this bill.
And a copy will be submitted to the speaker.
Yes,
For
Madam
the-
Speaker. Yes.
On that motion, are there any objections? Yes, Madam Committee on Rules Chair, Senator Lee, you are recognized.
Yeah, if you could just
State the
reiterate.
reason. Yes, thank you, Senator Lee. If you could state the reason, Senator Moylan, please.
Thank you, ma'am. Reason for request for recuse is that though it's not in direct conflict, I was in the insurance business and have dealt excessively with these types of contracts, and though the current carrier is not in direct conflict, the company is still assisting with different measures with the current contracted insurance companies. So therefore, I kindly request to recuse myself.
Thank you, Senator Moylan. On that motion, are there any objections? Hearing none, motion carries. I will give the sponsor of the legislation an opportunity to give opening remarks on this bill. After the questioning spirit, the sponsor will close, and we will rise out of the Committee of the Whole with a recommendation. So at this time, to open up this...
Madam Speaker, are we going
Yes.
to have BBMR here or only DOA today?
Department of Administration was the one that was requested, and OFB is in the back, and they will be ready to answer any of the questions. And if you want them in, we can do that right now. Sergeant of Arms, is the members of OFB here? Any member? I will take a moment's recess.
Madam Speaker, oh, sorry.
Colleagues, y minuto 35, the legislature in Guam is back from recess. And at this time, again, I will give the opportunity for the sponsor to do. Senator Terlahi.
Thank you, Madam Speaker. I just want to put on the record that, yes, I did ask for BBMR because the bill has been amended on the floor or by the committee, and I think the fiscal note that BBMR submitted to us did not incorporate the changes that were made in this amended version. So I just wanted to hear from BBMR whether they expected, additional price tag on this bill or not. I will ask DOA when it's my turn, though.
Thank you, Senator Terlahi. Duly noted. Senator Pito Terlahi, you are recognized.
Good morning, Madam Speaker. Before I share some of my thoughts this morning, I want to apologize for my tone of voice yesterday. I was just kind of just feeling bad for the rebuttal on Bill 225. Good morning, Mr. Director. Thank you very much for joining us. Joining the Committee of the Whole this morning to discuss the merits of providing choice to our subscribers versus the responsibility to be fiscally responsible in light of this global pandemic. While I understand the need to control the cost of the government insurance contract, I also recognize the importance of providing choice to our subscribers. And I listened intently to the public hearing for this bill, and I understand that controlling the cost was paramount to the Department of Administration and our body as well. But too many of our retirees and employees have reached to my office and your office as well, and they want us to allow them choice. Whether it was reimbursed out-of-pocket costs, the inability to receive services in an expedient manner, simply being unable to secure an appointment in a few cases, I am aware of some death. Choice of insurance and being comfortable with the carrier is their main concern, Mr. Director. My office has worked with the committee chair on our office to allow a mechanism for the governor to choose a carrier that would be awarded the contract, and if subscribers want a different qualified candidate, they could pay any additional premium to assess their coverage. Balancing the need to fiscally responsible against providing peace of mind in our subscribers is a difficult choice. No one wants to spend any additional dollar, but we also need to recognize the responsibility we have for the health and well-being of our residents. Thank you very much, Madam Speaker. Thank you, Mr. Breen, for being with us this morning, and thank you for your service.
Senator Terlahi, do you have any questions to ask?
Yes, I do, Madam Speaker.
Yes, I will afford you that time right now, sir.
Thank you very much, Madam Speaker. According to the study by the National Institute of Health, change of health insurance caused patients to delay seeking care, resulting in negative medical outcomes, including death. Because Aetna is now carrier for Government of Guam, 100% of Government of Guam employees had to change health insurance. With an exclusive carrier-only option, there is a greater chance of consistently having to change health insurance. The process of transferring patient data needs to be streamlined so there is interruption in the continuity of care. It's literally a matter of life and death. In switching, Mr. Brim, to Aetna, there was delay and confusion for the first couple of months. Do you have any idea how many people received negative medical outcomes, including death, as a result of the change of the health care?
Senator, thank you for the question. You are correct that if you only have one carrier, there is a possibility that everyone will have to re-enroll. When we went through that exercise last year, because we had a new carrier, it was a concern. But the biggest problem we had was the time that we had available to enroll everybody because of the protests that had led up to the final award. We were left with very few weeks at the end of, just before the end of the fiscal year in order to enroll them. And as a result, we had to extend the enrollment into the new fiscal year. We learned that lesson. So this year in the RFP, we have required that all carriers are required to submit to the government the list of their enrollees, which wasn't available last year because the two existing carriers actually refused to do so. So we've made it a part of the RFP that they are required to do so should we make a change this year. In doing this, we very much hope that the whole transfer, should it be necessary, or should an option be available, will be much smoother because of that requirement.
Thank you very much, sir. Thank you very much for your response. In the year 2018, the Office of Accountability mentioned that the analysis showed that 84% of subscribers per year did not choose the lowest cost carrier options. If an inclusive contract option is selected in fiscal year 2019, the change may be disruptive to employees who are used to going to a particular service provider that may not be within network of the single carrier and thus be very costly to the employees in the long run. In light of this analysis, Mr. Bim, from the public auditor, do you have data on how much more it is costing the employees in the long run when they have to switch to health insurance provider?
Thank you, Senator. You were right. In 2018, not everybody, fiscal 2018, not everybody did choose the lowest cost provider. People make a choice based upon, if the choice is available, based upon the breadth of the network. And one of the carriers at that time had a restricted network. That issue was dealt with by this body in extending that network to include GRMC. So that issue, although a concern, shouldn't be such an issue going forward.
Thank you very much, sir. Question number 3, sir. Title 5, GCA Chapter 5, Section 5008 lays out as a policy for the government of Guam that there is policy in favor of local procurement, including preference for companies doing a substantial portion of its business on Guam. And that was one of my statement, the main issue, because I feel that if we do have a provider that is on Guam, it goes back to actually helping out with our economy. Doing a substantial portion of his business on Guam is what I had mentioned, which has already been low for decades. We should at least have a choice to buy local when it comes to health insurance. In difficult economic times like this, we need our taxpayers' dollars to circulate within our economy instead of being exported or violent. The overall economic impact of the health insurance choice should be examined, including the positive economic multiplier for local choice. Buying local means local jobs, which support the families here on the island. And that is the bottom line, Mr. Director. Now, the question is, do you analyze the economic impact when you choose an off-island company as the health insurance carrier, or do you have data showing how many jobs were lost on Guam because of the health insurance contract went to the off-island carrier?
Senator, at this present time, it's not a duty of the negotiating committee to consider the economic impact of the choice. The legislation is pretty clear that it requires the committee to look at the bids, not the economic result of the bids. I'm getting close to the negotiating issues, so I must be careful what I say, because we're in the middle of negotiation for the current year. But I think if we were to look at it, and this is just an off-the-cuff remark because we haven't done a full study for the reasons I just explained, that the current carrier has employed, I don't know how many, but I know they have employed people locally, and they've set up an office locally. And that was something that happened during the course after their award. So it would be hard to measure the economic impact before an award. But certainly it is something that if you think should be looked at, then we will certainly look at that if we were given the powers to do so.
Thank you, Ed. At this time, thank you, Senator Chalahi. At this time, I will afford the opportunity. I will just work from the first row back, and I will give the opportunity for each senator now to ask the one question and then come back for a second round. So, Senator Chalahi, Therese.
I apologize, Madam Speaker. Point of order. You were mentioning in the very beginning, you were saying that you were going to give us 5 minutes, and then just now you stated that we're allowed one question. So I just wanted to verify which one it is.
Yes. So in the beginning, questions for the panel will be asked in 2 rounds. Each senator will have a 5-minute time limit. And I will only entertain amendments that were submitted through the clerk. If there's an amendment, I will turn and ask if the clerk has a copy of it. If she does, I will ask the senator to repeat.
Thank you very much, Madam Speaker.
You're very
So just
welcome,
one.
Senator. At this time, Senator Therese Chalahi, I will acknowledge you, and then we will work down front row, second row, third row.
I'm sorry, Madam Speaker. Can you just repeat that? Is this our 5-minute time or our
Yes,
question
because
time? Or one
5
question
minutes,
for one question?
inclusive of question 1 round, and then you'll come back for a second round. This is standard. We've been doing this, and I'm allowing you the opportunity to
Well,
speak at this time.
If you could come back to me, Madam Speaker. Yeah.
Okay, thank you very much. Senator Kelly Marsh Taitano, do you have a question or comment?
Suzuis Masi, Madam Chair. I do have several questions. I was going to weigh them out according to what had been asked before me. So I'm just getting them in order then. So there had been some discussion about lessons learned. Is it part of the process, either at the end or beginning of the meetings, to discuss strengths and challenges of the process so that there are always those lessons learned and improvement of the process?
Yes, Senator, you're right. In any exercise, there are always lessons to be learned. And the way that the committee has tried to ensure that those lessons get enshrined into the new contract is by requiring the bidders to submit customer satisfaction surveys. And again, I can't get too close to the actual process, but we have asked bidders to submit customer satisfaction surveys, and they will be reviewed by the committee.
We saw a petition with, if I remember correctly, 1,500 or so signatures on it. And while, of course, customer satisfaction is key and always should be what we work to ensure that the insurance companies are improving and that we're managing the contract properly, What is your estimate of the percentage of satisfied customers at this point so that we can weigh it all out?
Always difficult to answer that, Senator, because people that are satisfied tend not to express their satisfaction as loudly as people who are dissatisfied. We have had people come into the office and say they're satisfied, and I did note that there was a petition, and there were something like, it was just under 1,500 people. I guess to put it into perspective, and from what I could tell from that petition, it included all family members. To put it into perspective, employees, retirees, and their dependents, the total is about 26,000.
You mentioned the customer service surveys. So is there a way to improve that part of the process where you get a better understanding of the level of customer satisfaction prior to the next year's negotiation?
The customer satisfaction survey, Senator, is part of the bidder's bid. So it's really up to them to present that in the best way that they feel that it presents their case. And obviously, I think it's fair to assume that they want to present their best case when they're bidding. The negotiating team hasn't yet reviewed these. It's on the point of doing so. But I think we've found over the years that that is a reasonable way to establish how their operation has been accepted by the people that they serve. And again, this is the first year that we've actually had one rather than multiple. In 2 years ago there were three. So it should be easier this time to review the surveys because we've only got one bidder in current year, and previous bidders will have to rely upon previous year's surveys.
Some of what we've discussed is ways to improve the management of the contract. You've been part of this process for a while. So are there improvements to the negotiating process or the management of the contract that you think are important for us to consider or for everyone to be hearing about?
Yes, Senator, we're always looking at improving the contract, improving performance, making sure that if people have a concern, and many people express that concern, that it's not only addressed in the current year, but the contract for the ensuing year tries to capture that issue. And one of the ones that I just mentioned was the requirement to forward to us the list of enrollees, because we learned from that transfer last year that although requested, it wasn't mandatory, and we lacked that information.
In the language of the way that the bill has been amended, there's language there where it mentions best, most economic, and beneficial, but then it also mentions, and I'm trying to find it, but then it also mentions just forwarding those that qualify. Do you see ways that we can make that language fit the purpose better? Because it feels like there's a disconnect between best, economical, beneficial, and then qualified.
Well, as written, this legislation would require the committee to forward all the submissions. The purpose of having a negotiating committee is to clarify bids and score those bids. And the scoring was what allowed us in the past to submit one or two most beneficial bids. In this case, it would appear that the committee would have to forward all the bids. It doesn't specify whether the scoring would be submitted along with that submission, but clearly I think it would be helpful to anybody reviewing it, whether it's the governor, the speaker, the chief justice, to know what the scoring was. And so this body might consider including that in this provision.
In what way would this language, the way that it's written and forwarding potentially all applications, affect your ability to negotiate a cost-effective measure?
I'm sorry, Senator, could you repeat that?
Well, you were saying that with the negotiating team, part of what you're trying to do is to vet these and rate and rank them. Will this affect the cost in any way to be forwarding all of these qualified ones? Because we are trying to figure out what the cost impact is.
Each bidder must price their bid as they see fit. If a bidder knows that it's a single bid that's going to be accepted, then it knows it's going to have the total population, which, as I said, is around about 26,000. If it's not sure of how much percentage of that population it's going to get, it may choose, but that's up to the bidder, not up to the committee. It's up to the bidder to determine whether to price that uncertainty into the bid or not, because the bidder has certain fixed costs that he tries to recover in the contract. It may choose, because of commercial considerations, to ignore that because by submitting a competitive bid, it is more likely to capture more people than somebody that submits a uncompetitive bid but prices in that risk.
Thank you, Ed. Thank you, Senator. We can get you on the next round. Senator Will Castro. Okay. Senator Sabina Perez, do you have any questions or comments at this time?
Yes, thank you, Madam Speaker. Thank you, Mr. Byrne, for being here today. I think, have you had a chance to look at the amended version of the bill?
I have since I arrived, yes, thank you.
Okay. So I just wanted you to, I guess, weigh in regarding how feasible would it be to, so I guess in the amended bill, so how feasible would it be for DOA to facilitate, to allow for subscribers to opt for another carrier? I guess that's one part of the question.
I'm sorry, could you repeat that? I didn't catch all the words.
Yeah, I think, a lot of the questions I think were answered through my colleague earlier regarding, as far as how does one determine, or whether the complaints by the carrier how is that folded into the next negotiations. So I think that's good that that's included in the process.
Well, as I explained, Senator, we look at these satisfaction surveys or customer service surveys that are required as part of the bid. And as I explained, it's up to the bidder to put that in the best light for their own bid. But we obviously have our own records of the performance of each bidder, and that goes into the scoring. But it's part of the scoring. Cost is another part of the scoring, but there are other factors too.
Yeah, I think some of the complaints probably stem from the lack of seamlessness of coverage between providers. And I see that some of the shifts that have happened really kind of left out some of the employees and retirees. So I know you don't want to give away too much because you're in the middle of your negotiations, but I guess to what extent, is that considered perhaps, I guess this also probably stems from satisfaction. So I just,
If I may, Senator, just to pick up on something you said, and I think this is important, if I may, that if this legislation is passed and there is a choice available to subscribers, it is important that the subscriber take all his or her dependents with them into that choice. I think it would be difficult, very difficult indeed, and perhaps lead to family conflict if a family each chose a different provider. So I think it would be important that whatever choice is made by the subscriber holds for the whole of his or her dependents.
I think that's it for now. Thank you.
Thank you, Senator Paris. Legislative Secretary Shelton, you are recognized.
Thank you, Madam Speaker. Thank you for being here, Mr. Byrne, to answer our questions. For all of the senators in the room and for our viewing public, can you walk us through the timeline of the insurance negotiation process?
Yes, Senator. It's a lengthy process because we don't know how many bidders we're going to get, so we have to allow ourselves sufficient time. And as I said earlier in answer to the Senator's question, last year was particularly challenging because we had a protest that stopped the whole process for about 2 months, and we lost 2 months on that. But basically, we start this process out at the beginning of February, and we hope to conclude it by the end of July, because we want to be able to advise the committee that's looking at the budget for the ensuing year what the actual cost is. And we're working to that timeline because we're cognizant of that, and I hope we don't get anything that stops us, some external reason for stopping us this year.
Okay, thank you very much. And so the way I read the amended bill, that this act shall be effective upon enactment. So we are in the middle of the negotiation process. We won't hear any decision from the negotiating team until July, as you said. So if we pass this bill in this session and it lapses into law, or the governor signs it into law, there is a chance that this will affect the insurance negotiation process, the current one.
Yes, Senator, more than a chance. It will affect it, might delay it. So again, the body might consider delaying this the effective date of this until next year, in order that this year's process can go through in time to get everybody enrolled and not have the difficulty that we encountered last year.
Okay. Mr. Byrne, in the last insurance negotiation process, there were multiple bidders. Is that correct?
Yes.
Okay, and so when at the end of the process, you were able to see the lowest cost bidder and then rank after them based on the costliness of what they had to offer, right?
Yes, Senator.
Okay, so if we were to pass this bill as it is, it be enacted right now, is it fair to say that we would just take the top 2 from that list the same way you had a list in the previous negotiations?
Not as I read the bill. I think it says that we have to forward all bids to the governor to take a choice. And that's why, in answer to the senator's question, I talked about the ranking that goes along with that, which we would certainly, the committee spends, and if I may, I'd like to pay tribute to the people on the committee who devote a lot of time, a lot of personal time sometimes, towards this process. The committee takes great care to complete that scoring accurately, and it takes great care to make sure that when it does submit whatever choice it makes, that it's thoroughly reviewed. So if that process were taken away from the committee, I think the reviewer would have a hard time understanding the complexity of the bids.
Okay, thank you. And I do appreciate all the work the negotiating team does, the many hours that you put into the whole process. Can you give us, from the last negotiating process, what the difference in price was from the lowest provider and then the second provider? What was that cost per employee or retiree of the government?
I can't tell you offhand what it was per employee, but of the total package, it was 11%.
Thank you, Mr. Byrne. I appreciate that information, and I would like to know the breakdown, if you can provide that to us, what it is per retiree or employee, because as the bill is written, whatever the difference is in the top provider and then the second choice, that would be a cost that our employees or retirees, if they choose the other provider, the costlier provider, would have to pay out of pocket. And so I'd like to know what we are going to provide all of our employees and retirees in the government of Guam, and have them know upfront what that choice is going to be and what they can be expecting to pay. So if you could provide that number, I would greatly appreciate it. That's all.
Yes, Senator, if I could, though, a word of caution. I think the procurement laws prevent us from giving certain information, but I will go back and advise you of that.
To the best of your ability. Thank
Yes,
you very
yes,
much. Okay, thank you very much, Madam Speaker.
Thank you, Legislative Secretary. Senator Luis Muñoz.
Madam Speaker, can I reserve my round for the next time? Next round.
Thank you. Minority Leader, you are recognized.
Sujus Masi, Madam Speaker, and good morning to my colleagues, and good morning, Mr. Byrne. Thank you for being here today. I know you're a very, very busy man, but we this body greatly appreciates your attendance here today, and all the other ones that you've had prior to that, too. So, Mr. Burns, as you know, you didn't really have a chance to review the amended version of this bill. However, in the bill, it indicated to include not only the government of Guam, the executive branch line agencies, but it also included autonomous agencies, semi-autonomous agencies, public corporations in this legislation. So that being said, when you incorporate more into the pool, does that lower the cost of insurance?
In theory, Senator, the bigger the pool, the better the risk is spread. At the moment, under current legislation, most of the autonomous agencies are included in the pool. In the previous year, the judiciary and GIDA chose to opt for a separate policy.
Thank you.
This year, it's only the judiciary.
Okay. Thank you, Mr. Byrne. And if I'm not mistaken, okay, I lost my train of thought on that one. I'll just come back to that one. So, Mr. Byrne, any rebate given to the carriers, given by the carriers, rebates, like at the end of the term, after the claims are below 86% of the claim, that rebate is given back. Now, is that rebate given back to the government and Guam employees and retirees who actually contributed some of the premiums, the cost of the insurance, or is it fully given back, all rebates given back to the government of Guam?
in the last 2 years, there hasn't been a rebate, but were a rebate to be offered, and the structure of that rebate is part of the negotiating process. In past budgets, it was used to pay for a portion of the retiree contribution, which is fully funded by the government of Guam. The fact that we haven't been able to get a rebate for the last 2 years is what's caused the need to increase that appropriation in order to pay for a portion of the retiree contributions.
Mr. Byrne, during the amount that was set aside for the insurance, that was an estimate at the beginning of the year, because you really don't know exactly how much it's going to cost the government of Guam, depending on the enrollees. So previously, in the past, usually things don't get negotiated or rolling until the end of July or August. I understand that you've already put RFPs out. You're getting solicitations that are coming in. However, isn't it been in the past that any kind of negotiations really doesn't start until July? So even though if this bill should pass into law, there is still time to go through the process of this negotiations. Sorry, I didn't mean that as a question, because technically it is. If you look at past history, it's been doing that. Now, Mr. Byrne, there is what's called a performance guarantee. It's done quarterly based on the insurance carrier. And this performance guarantee provides, in the event they fail to provide certain services, there's a penalty involved, a penalty that can exceed up to 14%. So my question to you is, since Aetna has been into office and has been our carrier, and we have had countless complaints. I think this is the first time in history that we've had a resolution by the Mayor's Council, voicing their concerns about this insurance company. Over 1,400 petitioners. Now, I remember in the last comment that you made, and even during the public hearing, you said that you do receive this through HR. People are supposed to come down there and through HR. But some people are kind of afraid to do so. But I think it speaks wealth of the amount of people who are coming forward now. And so my question to you is, in the quarterly report, has Aetna instilled any of these penalties on this insurance company?
I think you might have misunderstood the 14%, Senator. The 14% is the medical loss ratio.
Right, sorry about that. But I know that there is a penalty every quarter, and I think it's a dollar amount. I'm sorry, I was mixing the two up, crosswire there. But yeah, it's like a list actually that you have of requirements, and if they fail to meet it, some is $1,000 and some is, X amount. It's all in dollar amount. So again, has there been any of those penalties installed into this insurance company?
No, because no, there hasn't. And we've done our best to make sure that any complaint is resolved. I understand that some people may have wished to express a complaint, but so long as the patient is requesting a service that is within the contract, then that complaint was resolved. Some patients choose to try and attain services beyond what the contract provides, and that's generally where a conflict arises.
But Mr. Byrne, some of these things require like a certain amount of time, that when a phone rings and it's answered by the insurance company, there are certain things in that require a referral in a timely manner. There are certain things in this agreement that they have to follow that it's simple, but how do you get that data? And by the way, you're saying no, that's your answer, so I'm not going to expound on that, but I find that very odd, considering all the complaints that have been coming in. And some of those have to do with just answering the phone in a timely manner. And that is part of the agreement. But the one thing you mentioned earlier too, that the reason why my last question, Madam Speaker, is that I think earlier you mentioned on that data was not provided to DOA by the carriers, or they refused to provide this data. And the reason really was because DOE did not provide a HIPAA agreement to protect against any misuse of this data, a HIPAA agreement. So why did DOA not provide them this agreement, especially regarding HIPAA, to the protection of data and information? And how important is that data?
Senator, I'm not sure I agree with what you just said. And this is the first time that actually I've heard that was the impediment. There were two types of data that were requested. One was the enrollment, for obvious reasons, because information was kept by the then carriers. There was also pharmaceutical information that was requested, so that people who were taking drugs wouldn't have to start the drug regimen from the start again, because if there was some kind of progressive treatment, that the progressive treatment was recognized by the provision of that information being transferred over. We asked about that, and we were advised that was the normal process that takes place between transitioning carriers, but unfortunately it wasn't provided to us.
Thank you, Mr.
Thank
Byrne.
you.
Thank you, Madam Speaker.
Thank you, Minority Leader. Senator Clint Wright-Chow, do you have any questions this round or comments? Senator Jolson Augustine, you're recognized.
Thank you, Madam Speaker. Mr. Byrne, one simple question to start. During the RFP, does the government of Guam ever establish what the minimum the government of Guam will pay based on the average the government of Guam has been paying for the many years or the several years? Have they ever started out with that process, like, stating if the government of Guam has been paying $100 million a year, this is the minimum we will pay for insurance? Has that ever been put into any RFP?
Thank you, Senator. I don't think it was quite expressed in that way. The negotiation last year that we undertook was taken in the context of the previous year having a rollover. So we were aware that the premium that was being considered when we were looking at the bids last year was artificially constrained by the previous rollover. So we were expecting a higher than normal annual increase because effectively we were dealing with a 2-year increase. But in answer to your question, as you know, when the budget process starts much earlier, and this is going on in parallel with the negotiating process for health insurance. So we're very keen to make sure that any increase that might be contemplated or bid by the carriers is minimized to the greatest extent possible. I don't think that there's been any year where the bid has been less than the previous year.
Okay. Now, you have the bill, the amended bill in front of you, Mr. Byrne. Moving down on page 2. Because it states on line 2, before March 1st of each year. Wouldn't that be interpreted by the administration or even yourself in negotiating that's when everything starts? Not wait until there appears to be a safe assumption in this body that if we pass the bill today, you can still go back in when I'm looking at this, shall obtain the concurrence of the branch electing by March 1st. So everything is starting on March 1st. The ball is rolling. you can't turn back the clock. You can only move forward to the next date, right? So, and it also identified, and you mentioned, Mr. Byrne, earlier that I guess all GovCom entities are involved and they all participate in this insurance? Everyone? GPA, GWA, court, Guam Legislature, everyone?
This year, the court, it was the only entity that chose to undertake negotiations for a separate policy. And if I could also clarify that, it's only the active members of the judiciary. The retirees are included under the retirement plan under the General Gov Guam. We did start the negotiation back in February with a representative of the court because they hadn't expressed their desire to go their own way at that time. But as soon as they did, that representative had to leave the negotiating committee, and they're undertaking, I believe, their own procurement.
Do you believe that if the bill was amended to include them so that nobody has the option to opt out, like you mentioned, the more subscribers, the likelihood the cost could come down because it's spread across the board?
Yes, I think there are two advantages, Senator. One is the bigger the pool, the likelihood the cost will be kept down because you've got more lives being insured. But also, as far as the Gov Guam has a classified service, and everybody fits into a category, and part of their compensation is the health insurance. And if you have a part of the government with a separate benefit, with possibly separate medical benefits in the policy, it does create an inequity there too.
Okay, Mr. Byrne, last question. Page 1 on line 7, they struck out 1, which is the top one, but referred to the 2 insurance company. Wouldn't it be wise to say then that why the top 2 when maybe, I don't know if the 1,400 signatures are complaining about the current insurance would be able to obtain the insurance they prefer. If they didn't get the top 2, we're going to come right back to the same table. Am I correct? And say that there's 1,400 complaints?
Yes, Senator, that certainly would be an option, is that 2 would be easier to deal with. 3 might be difficult to deal with because then you have to have a schedule of contributions that's different, and we all rely upon computers, so you'd have to put into for their deductions a different amount depending upon their choice. So
but Mr. Byrne, if the standard is set, let's just hypothetically say that the lowest becomes the base.
Yes.
GovGuam will not pay any more than this. You choose any other insurance you want, you pay the difference. That's what mentioned earlier by one of my colleagues. Would that be just as easy? Because it doesn't matter which insurance you go to. When they file the claim and GovGuam has to pay, because that's what they sign up, you're only going to pay the set amount, and the different class of services provided will be standard across the board through all insurance.
Yeah, it's only a matter of the contribution. You're correct. And it would be a different contribution if it's like buying up, right? That could work.
All right. Thank you, sir. Thank you, Madam Speaker.
Thank you, Senator San Augustine. Vice Speaker Nelson, you are recognized.
Thank you, Madam Speaker. Mr. Byrne, when you came and testified on this bill, you wrote a letter with several concerns. And so I just wanted, this bill is very, very different now. The substituted version of this bill is very, very different now. Have you had a chance to review the substituted version?
Only this morning, Senator. Unfortunately, it's only 3 pages.
Okay. Do you still have the same concerns with the substituted version as you did with the original version of the bill?
In part, and in part, no.
Can you please explain the in part not?
Yes, I will.
Thank
And
you.
there's an important provision in this bill that hasn't come up yet, but I welcome the opportunity to highlight, is that both bills had this sentence, that health benefits provided under this authority may be self-funded and administered by a third party if it is determined to be cost-effective. This is something we're looking at actively because I feel that it probably will be cost-effective. In fact, we have asked bidders to consider bidding with this kind of requirement. So this is a provision of which I welcome in this bill because it gives us the option to do that. And with the number of lives that we have, I certainly feel that the government of Guam can get some advantage from being self-funded with certain safeguards, like a stop loss, and that's one of the things we're having to look at. But the committee is spending some of its time at looking at this as a cost-saving measure.
Can you explain the role of the third party? Like what would?
Yes. There are various ways of doing it, but I think the most common way is this, that you engage with it's a TPA, a third-party administrator, who are sometimes insurance companies like the ones we currently are used to dealing with. Sometimes they're separate companies, and what they do is administer the claim. They determine the network, although there is more government or customer input into the breadth of the network. They administer the claim as they would normally would, but the only difference is then is that the customer pays that claim rather than it coming out of the insurance company reserves. And the cost advantage that you see immediately is that the insurance company doesn't have to set up the reserve. It would be the government that did, and therefore we wouldn't be paying for that reserve in the premiums.
Thank you. You also mentioned that for us to not move forward with this type of legislation, because really the concern here is the lack of customer care support to our subscribers or to the subscribers of the insurance. And so how does Department of Administration or how does DOE address those concerns? I mean, we know that there was over 1,400 signatures and you consider doubling it or tripling it compared to family size, but how does DOA really interact with those that have issues with the insurance and are not able to get the care that they believe that they should be provided?
Well, Senator, I'm very well aware, and all the people that work in the HR and Benefits Department at DOA, as far as the line agencies are concerned, are very much aware that we're serving GovGuam employees. And it's our duty to make sure that the employees get the best health care that can be afforded. So we often get people coming and talking to us about, usually it's a claim, sometimes it's a subscription problem, but usually it's a claim or the need to get a particular drug because of particular medical circumstances. The first stop must be the carrier, because they're the people that are supposed to be administering this. But if they feel that they don't get the attention they need from the carrier, they come and talk to us, both the line agencies and the autonomous agencies, and we try and resolve it. Sometimes, as I said before, the subscriber is wanting a benefit that just isn't in the policy. And we tell them that, and of course nobody likes to be told that there's a benefit that they can't get because it wasn't a prescribed benefit. But all insurance carriers publish their schedule of benefits. Our carrier did. It was done by previous characters in previous years. And we, as I said also before in response to Senator Marsh's question, we also look at the satisfaction surveys, and I know this it's kind of a backwards look because the petition is a dissatisfaction survey, and I don't think anybody's going to submit a dissatisfaction survey as part of their bid. But we're aware of it, and obviously we'll take note of it.
Thank you. Do you see an increase in the cost with the new changes to this bill? Do you see an increase in the cost to the government? And really, this COVID-19 has been a very peculiar time for us because now there's so many people unemployed, and then we have our government workers that have been employed, and so really this is the taxpayers' dollars, right? And so we want to make sure that there's some kind of equity for the island as a whole, as a community, both private and public sector. But do you see an increase of the cost for the way this bill is written, and if we should open it up to, instead of picking the two top carriers we would just open it up for everyone every carrier for those to avail to? Do you see an increase in that, in the cost?
As I said, Senator, it's very hard to determine how people price their bids based upon their expectation of the capture of a percentage of the population. You made reference to the current pandemic, and certainly all of us are aware that all of our health providers are doing things differently, and probably, and indeed that's something that we're talking to them about, probably incurring exceptional costs as a result of caring for patients who are either uninsured or lost their insurance in the private sector, and some of them have been able to go on to Medicaid and MIP, but some of them haven't. What that's going to do to medical costs over the next year is very hard to say. But I think anybody might conclude that medical costs are going to increase. I mean, we're all doing things differently. Hospitals, they've got lots of grants and things available to them, but they're having to take special protective measures and limit the number of people in there and limit patients' ability to get certain services. So I'm sure we're in for a period of significant medical cost disruption. It's our job to keep it as low as possible.
Thank you. And I just want to go to the last paragraph of your statement for the bill before it was substituted. It says, all of us share the goal of achieving a high level of medical care at a responsible, sustainable, and explainable cost. It is my advice, however, that the legislation crafted only 8 months into a health insurance contract is not the best way to achieve a commercial purpose. We have heard and responded to the complaints which were voiced at the beginning of this current contract. They were acted upon and anomalies corrected. Legislation cannot perfect a commercial negotiation. It should only be used as a framework, not a condition. And so with this substituted bill, do you feel that this legislation is putting in conditions that will impact negotiations with the insurance carriers?
I think I would always expect the market to respond with whatever the product, in this case it's medical insurance, the market, regulated albeit, but the market is best left to determine a good pricing for a product. However, I understand that in this case, we're talking about health insurance for a large population on the island, because a large percentage of the population works for the government, and medical insurance is or can be an emotional matter, especially if you're dealing with loved ones or life-threatening issues, and that's understood. But I still think that the market will over the long term, the market will price it effectively, and the mechanism that we have in there for medical loss ratio cost sharing should adjust for that and prevent anybody making super profits, because it would be returned to the government, and that's a good regulation because that fulfills its purpose. But within that, it's hard to answer your question fully until we actually evaluate all the bids. But I would generally feel that the market should price whatever the market feels the appropriate pricing to recover medical costs is.
Thank you, Mr. Byrne. Thank you, Madam Chair.
Vice Speaker, thank you very much. Senator Biscoli, you are recognized.
Sujaswasi, Madam Speaker, and good morning, colleagues. Mr. Byrne, thank you very much for being here with us today and for being open to answer our questions. Several of the questions that I had prepared have already been asked by several of my colleagues, and I'm also aware that some of the questions could potentially hinder current negotiations, so I understand that if you're unable to answer any of those questions. But Mr. Byrne, you did mention that you had a brief opportunity just this morning to review the bill as substituted. Is that correct?
Yes, Senator.
Thank you. In your testimony, you also stated that we shouldn't be persuaded that two proposals on acceptance will lead to lower costs. And based on the changes made in the bill, is this still your assertion?
Yeah, that was a comment made in response to one of the other parties providing testimony, who asserted that that was going to be the result of, the lower costs were going to be the result of two proposals. I think this body discounted that view some years ago when they changed the legislation to have a single proposal provider.
That is correct.
So that comment was really limited to that one remark. As I just said, Senator, in response to the Vice Speaker's question, the proof of the pudding is actually in the actual bids that come in.
Thank you. Mr. Byrne, beginning on page 3, line 1, Bill 255 would now require, and I know you answered some similar questions to this, but would now require employees and retirees to, quote, pay any difference in premiums between the most economical plan, as you described from the previous legislation, and another qualified plan of their choice. So if you could, maybe can you explain how this process might work, and what your thoughts are about how this could potentially affect projected costs for insurance as a whole?
Yes, Senator, thank you. At its simplest, and I'll go into a complication a bit later, but at its simplest, the lowest cost bid would establish the amount of the contribution that the government would make, and assuming that we didn't change the percentage that the subscriber makes, it's roughly 71% at the moment. The subscriber would continue to make that percentage, basically. If the subscriber chose a different plan, which had a higher cost, then the subscriber would pay the whole of the difference between the basic plan and what turned out to be the more expensive plan. The complication is, and we'd have to look at this, that some people choose to be in the 1500 plan and some people choose to be in the 2000 plan, and so we'd have a more complex schedule of additional contributions, but I'm confident that we could work through that.
Thank you, Mr. Byrne. Again, going back to your written testimony that was submitted, and I understand that this was prior to the substitute version that we're discussing today, you noted that there was several considerations that you made. And one of those was the difficulty in negotiating a multiple response solicitation. So you stated that the Health Insurance Negotiating Committee takes its responsibilities very seriously. It works hard, it works diligently to make the best recommendation to the governor. To make their task more complex and therefore less definitive is not in the best interest of the government, it's not in the best interest of the employees, and we have not yet completed a single 1 year with a single carrier, so we shouldn't rush to a conclusion based on incomplete information. So there are valid concerns that were brought up in this body about this measure potentially having negative consequences on the current round of negotiations for GovGuam Health Insurance Program. If the legislature were to move to delay the effective date of this bill until after this round is completed and well in advance of the next round, what date would you suggest that would be more appropriate and would kind of take into consideration some of your concerns?
Thank you, Senator, for that question. I think the answer is that if we moved the whole requirement of this legislation into the fiscal 22 years negotiation, which is the one after the one we're now currently concluding, we could get into the RFP factors that would deal with my concerns about having multiple bidders. The whole RFP structure at this moment is built around the assumption that we would end up with one bidder, because that's the current situation and the current legislation. So that's the complication that I was referring to, and something that could be cured by carefully examining the RFP before we went out next year.
Understood. Thank you very much, Mr. Byrne. I really appreciate your participation this morning, and I just want to thank you and the DOA team and really HR professionals across our government. I know that our offices have received a number of complaints on this issue. I'm sure, that's been the case at DOA. You had mentioned that. So again, I really just want to thank you and the team for your role in hearing from our community and working with this body to inform us and really help us to determine the best way forward that's going to take into consideration all of these concerns that have been brought to us. Sujos Masi, and thank you, Madam Speaker.
Thank you, Senator.
Thank you, Senator Lee. Senator Mary Torres, you're recognized.
Thank you, Madam Chair. Mr. Burns, Zus Masi for being here and for providing great insight into the insurance procurement issues and concerns and this bill and how it would impact that. What I am particularly concerned about with this, and maybe you can elaborate, is in the committee report there was much discussion about what the nuances are of having the RFP specs already out, the bids already submitted, and then changing the nature of it so that rather than it being an exclusive contract that you're going to negotiate and enter into, it's now going to morph into a non-exclusive of sorts. And of course, as you indicated many times, that will affect the pricing because the risks associated with non-exclusive are greater than exclusive in terms of price costs. But what I wanted to bring up and ask your opinion is this concept of buying up. If you contract, so essentially this will be, if this law passes, the government will contract with more than one provider. Not necessarily two, but certainly more than one. And the price that the government agrees to contribute will be based on a fixed price. And if an employee decides that they don't want to go with one which is a fixed price and go with the other which is a higher price, then they pay the difference. I think that what many of us are overlooking while we're sensitive to dissatisfaction with a carrier or services being covered is right now under Guam law, under 4 Guam Code annotated, the personnel policy, section 4301. That section provides that all retired employees and survivors who are enrolled shall enroll in a supplemental plan, and that the government's contribution for health and dental insurance shall be uniform within each class. And the other thing that it provides later in this is that the government shall increase contributions it makes on behalf of a retired employee or survivor so that the retired employee or the survivor of that retiree contributes no more than an active employee who is otherwise in the same class. So our government, as I understand, builds those protections so that retirees aren't penalized. They're lumped into one whole thing, and regardless of their health conditions, they don't pay any more than the next person. Now, this bill has a notwithstanding provision in it. So all these guarantees of the government matching and keeping the premiums for retirees the same is really out the window. Is that your understanding as well?
Yes, Senator, thank you for pointing that out. Based upon what I'm reading now, you're correct that retiree guarantee is less likely to operate effectively because of the wording and I guess it depends how the legislation is framed, but the way that the buy-up is expressed might cause that safeguard that's in the code at the moment to fail.
And I think that, as you point out, this is very emotional. A lot of the discussion is about how to better help people. And what this does is it gives a promise that you can get more, but it also says to you, you can get more at your price, on your dime. And if you consider that people in retirement are generally on fixed incomes, which are not necessarily sufficient if they're relying on Social Security or certain fixed benefits to them. And with the prevalence of non-communicable diseases and the like on Guam, you can't automatically say that this is a win-win situation and a solution to what they feel is insufficient medical coverage for them. Is that an accurate assessment of the impact of this bill to retirees?
Well, Senator, if I could say two things. This is a kind of unusual kind of buy-up. Normally a buy-up arises when the basic is an HMO type plan and you can opt to buy up to a PPO type plan. And that happens in many places, but this is a slightly different kind of buy-up, and that makes it that much more difficult to kind of predict how it's going to work. As far as the retirees are concerned, we have encouraged as many of those, and certainly those that are over 65, to enroll in the RSP plan, which has zero premium, and you have to enroll in Medicare in order to be in the RSP plan. But it is a great advantage for retirees to enroll in that plan if they so qualify. And then you could, I suppose, then say, well, this is the basic plan with no premium, and if you choose to buy up to the other plan, you could do so. But as you rightly point out, that might eat into some of their fixed income, but that might be their choice. If they have a particular reason for doing so, it might be cheaper for them to buy that insurance than incur the medical cost. And that's an individual decision that
Yes.
retirees would have to take.
That's understood, but one point that you brought up that's brought up in the committee report, it's roughly page 203 of 238 in the committee report. But one of the discussion points you brought up is that there's no certainty that the price that is offered by a carrier can be fixed absolutely, given that they would have presented that price based on a non-exclusive assumption, an exclusive assumption, and not a non-exclusive. And in other words, if we were to consider that, say hypothetically, the dissatisfaction rate of present people is 20% of the total insured. If you presume that 20 to 40% of those people migrated and bought up, the price that carrier proposed wasn't based on 40% of the market, it was based on 100% of the market. So you can't expect that they're going to keep their price at the proposal. And that's what I worry about is we cannot second guess that there'll be pricing guarantees at the time of the bid submittal, not knowing what the subscription numbers are going to be. And you pointed that out, and if you can just elaborate on that, I think we need to understand what we're talking about here.
Yes, Senator, that's correct. That if a bidder doesn't know how many, no matter what the product, I know that this is health insurance and emotional, as you pointed out, but no matter what the product, a supplier is going to price that product based upon a market assumption. Market assumptions in this area are very difficult to predict and can be very unreliable and very variable. So I can't really place myself in the position of a bidder. And they may choose to price it competitively, especially in the first year, because they want to capture as many people as possible. They may take the opposite view that the risk is too high, and we really don't. Although we need to bid, I think I've certainly worked for companies that when they didn't want a contract, they bid high in order to take themselves out of the running. It's difficult as we are in this current situation to know what an insurance bidder would do. We just have to rely upon them doing the best thing they can for their shareholders, but more importantly, their customers, because our subscribers are, in the end, their customers.
Thank you. I'll catch you on the next round, Senator Torres. Senator Therese Terlahi.
Thank you, Madam Speaker. Thank you, Mr. Byrne, for being here and for answering all our questions and for your earlier testimony on the original bill. So some of my concerns are on the changes in this new bill also, because the original bill had a cost estimate of, at least, or estimates of about $11 million, 11%, I think you said, about if we change from an exclusive to a non-exclusive at this point, based on last year's numbers. But do you believe that the other changes in this bill might change that cost estimate?
No, I don't think I've seen anything that would change the cost estimate, with the exception of our ability to either explore or use a self-funded option, which should reduce costs.
Self-funded option, meaning that's an option that has not been used
Correct.
ever by the negotiating team, and that means that's not part of this new bill. It was in law always, where we're going to self-insure ourselves, the government of Guam. And are you saying you're considering that this year?
It's certainly something we need to look at, one, because it is in the law, but it is also repeated in this bill.
It's repeated because we're amending a certain part of the law. Yeah, okay. So, but changing from the most economical and beneficial to what the bill now says, the top 2 companies, and then the bill strikes out the words that it strikes out the last paragraph on section 4301A that says no government funds shall be authorized or expended, and no contract shall be executed with any healthcare respondent for group insurance or for all employees or separate groups of employees and foster children of the government of Guam whose proposal does not represent the most economical and beneficial healthcare insurance proposal plan. Strikes out that language actually in 2 sections of our existing law and allows instead for the governor to contract with what's called the top 2 insurance companies. The top 2 is, if it's no longer defined as the most economical or beneficial, how would you get to the top 2?
Well, that's always a problem, as you know, Senator. But to pick up on what you just said, yes, it does delete that wording there, but I think it tries to substitute it later on, where it's talking about the difference in premiums. It's kind of, I guess, simpler wording, should be paid by the employee or retiree at their own cost. And I think that wording is designed to shift the additional cost from the government to the subscriber.
But I'm talking about the additional cost from shifting from an exclusive or the most economical proposal to a non-exclusive, meaning, from the one company to more than one, because that was what your cost estimate was based on.
And the only way to test that is to ask the question, what is your exclusive bid?
Right.
What is your non-exclusive bid? And the difference would be, I'm assuming that this is how we would apply it, the difference would be what the subscriber would be required to pay.
Oh, is that how you're reading that? So, so you might, but how could you, so do you believe this bill allows the governor to contract I mean, does she not have to choose between exclusive or non-exclusive at first? Or you're saying, now I guess I'm even
Yes,
more
I think that it kind of changes that process to the governor would have this menu of bids and providers, and some of them might have different health benefits that might complicate the situation, but then the difference between the cheapest, which would be the exclusive option, and the menu that's available, because all of them have to be forwarded, so all of them would have a different price. That difference would be what would be shifted to the subscriber.
What if she picked the contract? She's supposed to pick two. And what if she picked the two with the highest prices?
Yes, but there's she's supposed to pick two, but there's a whole menu
Right.
of submissions for her to select from.
Right, so that's why I'm asking, why do you say that then the cost for the subscriber would be based on the lowest cost? It might be based on the highest cost contract that she selected, or, yeah, isn't that possible?
Well, it might, but that would seem to be a difficult way to administer it, and I think the intention was to cause the subscriber to pay for a choice that was more expensive.
If the government's choice was cheaper.
Yes.
If.
Yes.
But that's not mandated anymore. Is that correct?
Yes, that's correct. Makes it, I think perhaps the wording needs to be tightened up in that respect.
All right. You mentioned that, okay, so this is for the Government of Guam's health insurance contract covering approximately 26,000 employees, families, and dependents, is what you said earlier. And that some of the complaints that you were aware about, that you've addressed many of them, but some of them are regarding benefits that are not in the policy. And could you tell us who determines the benefits?
Basically, the government determines the benefits unless they're mandated by law, and there are certain benefits, mental health caps were removed in the last negotiation. There are some benefits that are mandated by federal law.
All right, so some are mandated by local law, benefits.
Federal
certain
law,
coverage.
generally federal law.
And then some are federal law,
Yeah.
I mean, most of them. And then, and some, it's up to the negotiating committee to either include or not include. Is that correct?
Yes.
All right. Because I've heard this also, and I know that, I have several bills in my committee that are to mandate certain benefits that be included in the
Right.
Government of Guam's insurance contracts. All right. With this bill, then, you've already sent out your RFP and you've got responses. So the proposals are in.
Yes.
Would this bill require you to obtain new proposals? Or do a new RFP?
I really can't answer that fully because I haven't reviewed the RFP from beginning to end. But it certainly complicates the process, and it might require that, yes.
All right, so you've got your proposals in, and you're expecting to get to the legislature a decision, or the governor's, you got to get it to the governor, who is supposed to get it to the legislature no later than July 31. All right. But how long did you advertise your RFP?
I think it's 45 days, but I have to check that.
If the negotiating committee is not going to select the top two companies, and you are going to simply give all of the proposals to the governor to select. Could you do that right now? I mean,
Well,
what is I guess I'm
yes.
just trying to, it's a little bit of a tongue-in-cheek question. Yeah, what is the role of the negotiating committee if you're just going to pass the proposals on to the governor? All proposals, it says.
Well, I did refer to that earlier when I was suggesting that the negotiating committee should, no matter what, score these proposals, because the governor or anybody else reviewing these proposals would have to go back into the weeds of the proposal and effectively do the evaluation themselves without that guidance. I mean, the negotiating committee has a scoring system, and the whole RFP is kind of built around that scoring system to be responsive to that scoring system. So the negotiating committee should continue to do that. The governor or whoever else is reviewing it, I think, would be wise to at least take note of what the committee said. But it does, you're right, it does change the role of the negotiating committee somewhat.
All right, and so we're talking about choice of insurance companies who will insure you or insure the government. But could you talk again about choice of providers, meaning doctors, clinics, specialists? How is that decided?
That's an individual choice. The subscriber, the patient, must decide which particular provider, doctor, clinic, or indeed pharmacy they prefer.
So under the existing contract, when we switched over to an exclusive contract this year, were the choice in providers affected?
Very little, because the provider was using an existing contract. There was very little, with the obvious exception that they were required to include your MC, so that was an additional provider that was available to everybody.
Were there any other additional providers made available?
I couldn't tell you offhand, but most providers, to my knowledge, most providers on the island have some kind of contract with the current provider.
All right. What about off-island?
That is very difficult to say. I know, as far as the Philippines are concerned, the two main providers have a contract, they're now direct contracts with the current provider. On the mainland and in Hawaii, because the current provider is a US-based company with an existing large network, I think more facilities became available to patients because they were able to use that wider network.
That was my understanding, and from your last your last testimony, that many more, and I've heard of, cancer treatment centers also being included. But what about non-U.S.? Other countries?
There are providers, and I don't know that we've had some people use facilities in Taiwan and Thailand, I believe. I don't have a whole lot of statistics on that, but I am aware that some have chosen to use those facilities.
Thank you, Senator
All right.
Terlahi.
Okay, thank you.
Senator March Taitsino on round two.
Sidus Maasi, Madam Speaker, Chair. So along with the others, of course, I'm appreciating your time and your thoughtfulness of your responses. And you've gone over this a little bit already, but just to clarify, so with the changes of the function of the negotiating team in this bill, do you feel or would you assess that you were still properly giving the governor the proper tools to make the best economic, beneficial, and qualified choice on behalf of 26,000 subscribers. Do you think that's impacting? You said that they would have to potentially go into the weeds. Do you think that the tools that you're giving the governor and the legislature in making those choices, do you think that that's being impacted by this bill?
It could. I mean, it's again, we're having to put ourselves in the position of imagining a discussion with this bill in operation. It's a pretty hard task, even as it is, to arrive at a conclusion that we feel will be best for the government. And as is obvious, you can't satisfy everybody, and some people are dissatisfied. Some people certainly remain satisfied. So to put, as I think I said before, it's better if you can, within a regulation, to let the market determine the final result. If the market doesn't, for whatever reason, is unreliable or skewed, then you have to intervene. But the committee, in its deliberation, to try and reach three different factors is difficult, but it does so diligently, and that's basically Senator White takes so long to negotiate through the process.
You mentioned that if this bill passed, that your recommendation would be to do so for next year. However, you also said that we haven't seen this year of this new system fully play out and the lessons that it teach us. If we are to consider this bill, even if we push the date back, are you saying that our data for an informed decision is going to be incomplete then? And would you recommend getting more data by letting the year play out first so that all the lessons are in?
Well, when this current insurance year ends, at the end of September, there will be more, at least we'll have a whole year's data to make a decision on. At the moment, it's, especially in the current conditions, where I think all the providers have said they will cover COVID costs to a greater or lesser extent. So we don't know what those costs are at the moment. We've not got to the end of a year. The insurance companies haven't yet had an opportunity to review their reserves. But at least if we get into next year, most of that data will be accumulated by the time we get into it in February or January or February. We'll at least have 3 or 4 months for them to accumulate and validate that data. And I'm sure we all hope that the COVID threat has somewhat abated by then, and we'll be back to a kind of normal usage. I think everybody understands that because of the COVID emergency, some elective surgeries have had to be deferred, and therefore their cost isn't where it would normally be seen. And in order to really evaluate it properly, we would have to get back to a more near normal situation.
You mentioned that most of the line agencies are already part of the government, and the options to choose otherwise is the judiciary and the legislature. What entities would be folded in by this bill? Yesterday, GITA was mentioned, but what other entities out there? And by folding them in, does this mean that we're providing less choice for them?
I don't know, Senator. The agencies that are separate from us don't report to us, so I really don't know what they're doing. But as I say, it is at this moment, it's not a whole lot of people. At the moment, it's only the judiciary, and there's probably around 400 people plus their dependents. As I indicated, the judiciary's retirees are part of the general government plan.
By folding in these last few agencies, do you think, to the best of your understanding, do you think that that will make a difference? I think the intent was to make this as cost-effective as possible, but if it's very few and a handful of additional peoples, and maybe taking away their larger choices, do you think that that would make much of a difference fiscally in making it more cost-effective?
Statistically, maybe not, but anybody that has 100% of the market has the option to price it differently than if there is some kind of risk associated with their bid. So, 400 people plus their dependents, so it's probably 900 people in 26,000. I mean, it is statistically significant, but it may not make a whole lot of difference.
I'd like to look through to see if I have any straggling question amongst the mix, so if I could reserve my last minute or two for a follow-up question.
Thank you. Thank
If
you,
it's
Senator Marsh. Senator Will. Senator Sabina.
Yes, thank you, Madam Speaker. So I guess my question is, so how would you define most beneficial, and whether that definition can actually address a lot of the issues that we're seeing with the current provider? Because in my view, what's happening is that it seems to have affect invariably a population that we hold dear in our culture, which is the elderly population, and those that actually are utilizing the medical services, and which is why many go abroad for the cheaper cost. So I'm just, in that question, so can defining that term most beneficial encompass that and address those?
That is always the problem, Senator. It's a difficult provision to interpret, and that is why the committee goes through this elaborate scoring process. Everybody has their own idea of how it should be scored, and access to different types of providers, or I guess the breadth of the providers across the world, certainly is viewed by some as an advantage and viewed by others as a disadvantage. I mean, if to speaking kind of more generally, if patients are able to go off island to get a particular type of treatment, that might mitigate against people trying to provide that treatment on Guam. But that's again, it's a market adjustment that has to be made, and in the committee's evaluation, it's looking at all these factors and trying to interpret those words most beneficial as best as it can, because it's a judgment in the end.
Okay. The other question I have in regards to the bill, so I'm just wondering what the impact, so in the bill it states that, here, what does it say? On page 2, that the negotiating team shall forward all qualified proposals to Imagahagan Guahan for consideration and selection on those economical and beneficial health insurance plan. Do you foresee any impacts and how that would affect negotiations? If the bidders are knowing that whatever they bid is going to be automatically forwarded to the governor, and it's going to be based on her decision rather than...
You mean in this year's negotiation?
Just in general. In general, it doesn't have to be. But I'm just seeing that potentially, when companies are putting in their bids and they know that the decision would be placed on the governor, would that impact how these negotiations, or could it impact the negotiations as far as the cost?
Like any procurement, the way that the RFP, the bid is framed, to a large extent determines how people respond. So the bids that have been submitted currently are responsive to the RFP as it is currently framed. I think if this legislation were passed and affected this year's negotiation, bidders would want, they may not eventually change, but they certainly want an opportunity to review their bids to see if and how well their bid complies with this and whether they're likely to be successful with their bid under these new rules. But that's a choice of the bidder, not for us.
Does that open it up to more protests?
It might. Protests seem to happen, despite the best of intentions. We had a protest last year, and we had to work our way through it. It could certainly happen this year, and the protest last year was because of the legislation that was passed during that year. So it's possible, but it's up to the bidder how they evaluate that.
Okay. There's in the history we've had where I believe there was a company that pulled out from providing health care to GFT, and the members had to then look for another health insurance. So I'm just wondering what could be the potential unintended consequences, because in the past we had that choice, and then a company pulled out, leaving the members needing insurance. So I'm just wondering how that would impact, if there are any unintended consequences with this idea of choice, considering that happened.
Well, that's always a concern of any type of insurance, whether it's health or liability or property. If an insurance company decides to cease to cover that risk, you're generally left trying to cover that risk in some other way. Health insurance would be kind of catastrophic if that happened, because we would have to replace a policy mid-year with a competing policy, and the bidders that are left would certainly leverage the market to their advantage. But I sincerely hope such a thing doesn't happen, and the committee obviously evaluates the ability of the bidders to continue to cover the risk in their evaluations.
Okay, so this, we're all, grappling with this idea of choice, and we understand the larger pool, the lower the premiums, but then choice kind of might have that counter effect, where, do you see a potential where there could be sort of a self-selection of higher risk groups, having to pay even more because of the choice?
Yes, Senator, that's a possibility. That if you're in a risk group that needs certain type of care, it's certainly possible that you would choose to buy up in order to achieve that care. However, the committee in its original deliberations tries to make sure that the breadth of benefits covers as many people as possible, but there's always going to be outliers, and that happens to Medicare and Medicaid too, and so that's certainly a possibility. I can't tell you really how strong that possibility is.
Thank you, Mr. Byrne.
Thank you, Senator Perez. Legislative Secretary, do you have any comments, Senator Talahi, to Mr. Byrne, or questions to Mr. Byrne? We're not on the amendments, we're just on the questions to him.
Madam Speaker, I do have a follow-up question, but before I do that, can I ask your permission to have these copies run for our colleagues? This is the testimony that was done by the former Director of DOA, Christian Beleto. if I can have your permission to have copies so that we can provide our colleagues, the testimony from Mrs. Beleto.
We'll go ahead and take it, Senator Pito, and we'll go ahead and have the clerk upload it. And then a copy would be on everybody's computer.
Is that testimony on the vetoed and overridden bill or on this bill?
No, it would.
This is the Bill 3-34.
That's the bill that we overrode. Yes.
Okay. I will
Madam
allow.
Speaker, I just have one really short question for the good director here.
Please proceed.
Mr. Director, Christine Beleto testified before Speaker Cruz in opposition of Bill 3-34. And in her testimony, she stated the DOA wears two hats in the procurement of the contract, of the insurance contract. One is to manage the cost, and the other is to ensure that subscribers' needs are being met in the contract. And I just want to ask you this, is this still the position of the Department of Administration, or cost-cutting above all else?
No, Senator, it isn't. In my own testimony, I referred to the fact that Director Beleto testified against that bill, but it was overridden, and we're just operating under the new bill, and all our deliberations are well understood, and the negotiating team well understands that we have to operate within the frame of the current legislation.
Thank you very much, Mr. Director. Thank you.
Thank you, Senator Pito Terlahi. Senator Luis Muñoz, you are recognized.
Thank you, Mr. Byrne, for being here. And I'm sure you've probably answered a few questions that were asked many different ways with the same answer. I think that helps us really to process, depending on our understanding, because I know this negotiation process is not an easy process. You're dealing with thousands of people with different health issues, and so I could understand why maybe a good percentage of them are possibly dissatisfied with the way it is now as to the way they remember it to be. So if you just bear with us, and thank you so much for your patience. Now, I process a little bit better in numbers, so some of my questions will have some numbers in there, and maybe, and I'm sure you've probably already answered in many ways as well, but the current contract that we have now with our insurance company was $108.9 million for 2020. There's an 86% medical loss ratio that requires, which means of the $108.9 million paid to Aetna, or excuse me, our current insurance, I'm trying not to be specific, a minimum of $93.654 million, that's about 86% of the premium, must be spent on claims, or they will refund the difference. Is that correct?
Yes, that's the target, Senator.
Okay. The projected increase was about $11 million. So that means that the premiums would go up to about $119.9 million. This means that the claims of 86% of those premiums, or $103.114 million, some carriers will have to refund the difference. Is that okay? I mean, is that correct?
But yes, it would be assuming that the medical losses were the same under that different scenario.
So I'm trying to understand it. So the way I see it, I mean, we can't never really predict, the health care of people on a year-to-year basis. They may or may not get sicker, right? Or the use of healthcare dollars I don't know if they will use more healthcare dollars if there was one carrier or three carriers. The group will still use 93.654 million if there was one insurer or three insurers. That's the way I'm understanding it. The cost of GovGuam and its employees has less to do with the insurance companies, and if I understand it, has more to do with the cost of the hospitals and the clinics and providers and prescription medicine. I'm trying to understand the cost, the increase of costs when it's really up to the cost of the providers. Is that correct?
Most of it is, but I think you have to perhaps consider the situation where those that do, should they be given the choice, those that do choose to buy up would do so in the expectation of getting a service they didn't do under the more, they wouldn't receive under the more basic plan. And that in itself might cost more, it might not cost more, but there's a possibility that it might.
So so the problem then is that the negotiating team is only looking at the upfront costs and not necessarily the refunds that will occur if they utilize lower providers. Healthcare costs will go up not because of one or two or three carriers, they'll go up possibly because of the care of the hospitals and primary care and maybe whatever else they utilize, prescription drugs. My final question, so I'm just really trying to understand it, and thank you for acknowledging. My second question, does DOA or the OPA audit insurance companies to determine if they were accurately reporting their medical losses? What assurance do we have, that they're not sending extra payments to clinics that they own to avoid refunding premiums? For your
Yes, that's an important question, thank you. As part of the contract we have with our consultant, we cause them to complete an audit of the claims for that very reason, to ensure that claims are properly reported, and indeed they do find some differences where across that line, that medical loss line, some costs were in the wrong place, and we cause the insurance company to change their report, to report it properly. Like any audit, it's a sample, but we did, of the period where we had three providers, Aon, who are our consultants, did perform an audit of those claims.
So it is a requirement. Audits are a requirement.
It's a contractual requirement, yes.
Okay, but they have to perform it themselves then, so GovGuam doesn't perform the audits on them?
No,
You do?
we cause our consultant to perform the audit,
Okay.
and the consultant reports to the negotiating committee.
Okay, okay. Thank you, Madam Chair, that was
Thank you, Senator Muña. Minority Leader, I will recognize you this time.
Madam Speaker, can I just have 1 minute because I gave her the wrong information that you told me and I need to let her know, okay?
Take just a moment's recess. Y mi 35 na lista tunaguahan is back from recess. I do want to note, before I address the minority leader again, that this round 2 of questions or comments would be to the panel guest. And then after that, if we can try and make it before lunch, right when we come back from recess, we will only entertain amendments. So for the rest of my colleagues, if you have any questions or comments in reference to the bill, or to speak to address a question to the panel guests, please do so on this round 2. Okay? Thank you. Minority Leader, I will recognize you again.
Si Jus Masi, Madam Speaker. Madam Speaker, if I can be last on the second round, reserve it for the end and allow my other colleagues to go before me. I appreciate it.
I will allow that, Minority Leader. Senator Rachel, you are recognized.
Thank you, Madam Speaker. Mr. Byrne, just one question really is, when choice was provided in the past, did you see if all retirees typically chose to go with the cheaper plan?
No, Senator, they didn't. But that was the majority of retirees.
The majority would select the cheaper plan.
Yes, sir.
But some would opt to go for the more expensive plan?
Yes.
Thank you. Madam Chair, I have no further questions. Thank you.
Si Jus Masi, Senator Clinton Rachel. Senator Joseph Augustine, you are recognized.
Madam Speaker, I have no questions. I'm going to wait until the amendments portion. Thank you.
Si Jus Masi, Senator San Augustine. Senator Mary Torres, you are recognized.
Thank you, Madam Speaker. Mr. Byrne, thank you very much for answering all the questions. I think you gave a very good picture of the difficulty in changing the procurement specs of the insurance policies after the fact. I noted your recommendation that these sorts of things can be better vetted and addressed if we were to do it for fiscal year 2022. I also appreciate the fact that we highlighted, what impact this would have to retirees if they in fact wanted to opt out and buy up, and that the government would not match necessarily any costs that would be across the board, that if they opted up, it would be at their dime. So, those are things that in our system, and I know that didn't apply to foster child, but I know in our system we have many considerations that are in the law, personnel rules, that give consideration to our retirees, and I felt that it was important that we highlighted that. I don't have any further questions. I think that this body did a good job of vetting all the concerns and nuances that this bill might pose. So I just want to express Suzuis Maasi to Mr. Byrne.
Thank you, Senator Torres. Minority Leader, you're recognized again.
Okay. Si Jus Masi, Madam Speaker. Just a couple comments before I end with a couple questions before I end with some comments. It says that you believe that Public Law 34-83, which the law that was vetoed, allows for only one carrier and only one carrier, correct? I mean, that public law that was vetoed and became law, 34-83, clearly states that there is only one carrier, correct? It doesn't give the governor an authority, the authorization to have a choice. It's just one carrier, right?
Essentially, yeah, the veto was overridden.
Yeah.
What it actually provides for is that if the non-exclusive option is cheaper than the exclusive option, then the governor may choose that option But it hasn't happened that way because the exclusive option has habitually been cheaper than the non-exclusive option.
Okay.
And that's another complication in the whole process.
Okay, well, Madam Speaker, Bill 255 reflects the sentiments of many public sector employees and their families and friends. Not only is Bill 255 supported by 1,465 petitioner signers, the measure is supported by doctors and the Association of Pharmacies and the Mayor's Council of Guam, and most importantly, subscribers who have had firsthand experience in dealing with challenges under the current law. Madam Speaker, during session yesterday, it was mentioned that the current law allows choice contrary to what Bill 55 suggests. After reading Bill 255 and applicable statutes again, including Bill 3-34, which was vetoed and eventually overridden by the 34th Guam Legislature and now Public Law 34-83, I would like clarification from legal counsel on whether the current law allows choice in health insurance plans for employees. It's not clear. And I'm not getting that it was mentioned during the yesterday's session that the governor does have choice. But based on Public Law 3483, it's almost contradictory. Although 4 GCA Section 4301 states that the governor is authorized to enter contracts and reject proposals with one or more insurance companies, 4 GCA Section 4302 C9 states that only the single most economical and beneficial healthcare insurance proposal plan is forwarded by the negotiating team to the governor for consideration. Madam Speaker, Bill 255, we have an opportunity to ensure that concerns raised by those who have actually experienced issues with services, those who may be diagnosed with cancer or other life-threatening illnesses and still have to jump through hoops in order to get medical referrals, secure living arrangements, ensure their kids will be cared for while seeking treatment, and figure out how they will be able to pay for costly medical care. Madam Speaker, these are stories I've heard from subscribers, from mayors themselves, from their constituents, and from those who were satisfied before when they had options of choosing their health care insurance carrier. And just recently, a friend who had to have medical procedure was told by the current insurance agent that they have to fork out the funding for it and will be reimbursed later. Well, 2 weeks ago, I just heard from a former senator who still is waiting for his reimbursement. And that was since December of last year. Madam Speaker, as we read in the committee report on Bill 255, it was noted that federal government offers their employees the opportunity to choose their health care insurance plans. The federal government gives those options to their employees. Are we again going to be second-class citizens right here on our own island when we have the option to have choice? We can provide that same option for the government of Guam employees. Madam Speaker, why should subscribers and their dependents have to pay cost in advance? Why should they go through so many challenges before they get their medicine or to see a doctor? Why shouldn't we have a choice like they have had prior than Public Law 34-83? Thank you, Madam Speaker, for the opportunity to speak.
With that being said, there's no more questions to our panel. Senator Terlai, do you have a point of information? We've exhausted round 2.
Oh, no, I didn't get my second round, did I? No, I didn't. I don't remember that. No, I have some questions. Did I?
I will allow that one question.
Yeah, I don't think I did. Yeah, okay. Yeah, so I just wanted to clarify a couple of things, Mr. Byrne, while you're here. So this this new bill actually does not revert us to what we had in place prior to the last term, to that override. It doesn't even revert us to that because it doesn't require the negotiating team to submit both the exclusive and non-exclusive proposals to the governor. In fact, it says you must, or the governor must, contract with the top two. And so for me, that means the government of Guam cannot contract with an exclusive proposal. That's completely out of the question. Is that how you read this?
I think you could read it that way. I mean, it just says that the negotiating team has to submit the top two. It doesn't really say what happens to the top two.
No, if you look at the first section of the bill, so on section 2 of the bill, you submit all qualified proposals to the governor. But on section 1 of the bill, the governor, is authorized to enter contracts with the top 2 insurance companies. And I know you just saw this morning, so I'll give you some time.
Yes, I mean, it says the governor is authorized to enter contracts or reject proposals. Then it says it has to have the written concurrence of the Speaker and the Chief Justice, who may withhold consent to any of those decisions. And then it goes on to say the top two, but I don't know whether that means the governor could have rejected one of those top two under the first 2 lines.
It is very unclear, and I'm worried that with an RFP that was not fashioned pursuant to this law or this new bill, that it's like an invitation to lawsuit, if you ask me. If I don't know, if all the companies are involved, but that just seems like it's not clear. But if it could be interpreted the way I'm saying, that this actually precludes the government of Guam from going with an exclusive contract, for sure. That means this bill automatically, and I think that was your testimony, or even BBMR, it was BBMR's fiscal note that said that that's why they predict that it would have that impact, approximately, based on last year's numbers, approximately 11%. Impact right away if we had to switch from exclusive to non-exclusive. And that was not anticipated in the RFP or the proposals that were made by the company, I think. Now they should all be geared, if we're going to follow this, to completely non-exclusive. And so when you said that so that's completely different from the provision that says if you want to go with a different plan than what the government selected or the contracted with, you can do that. You're going to pay the difference, but doesn't that mean the government has to pay the basic amount? So that means that they would have to contract with all the providers. I mean, I guess I'm trying to figure out if there's more than 2 providers and they can pick of the remaining qualifying plans, isn't that as many companies as submitted a proposal? Assuming they're all qualified? Because qualified is different than the top 2.
Right, that is the issue that I think I've been trying to make sure that is understood, that the RFP at the moment isn't, you're right, it doesn't match these words. But you're right, I mean, in order to have a choice, there have to be two options. So there have to be 2 providers, otherwise there's no choice.
Right, but for the government, also, we have no choice. We are going with a non-exclusive proposal for sure,
Yes, because that's the only way to get an option. Right?
according to this.
Yes.
And so I want to just, while you're here, also clarify these use of the words choice and this exclusive versus non-exclusive, because they're trying to ask you earlier, that the existing law does not provide choice, but the existing law allowed for the government of Guam to select a non-exclusive or to contract to go with a non-exclusive decision, the choice, right? Meaning non-exclusive, meaning not one company, more than one company. That we could have had a choice if that's what the negotiating team decided was the most economical and beneficial, right? And you could have decided that, but it was not the facts in the submissions that you had before us. But under the current law, as you just said to my colleague, that yes, that is what the current law provides, because they keep trying to reinterpret it to say it doesn't allow us to do that, but it's in there. And you did consider non-exclusive options in last year's negotiating team, didn't you?
Yeah, I think it's important that we look more at the word choice.
Mm-hmm.
This legislation talks about insurance companies as the choice. I mean, we do have an element of choice now. You can choose to be in the 1500 plan or the 2000 plan, or if you're a retiree, you can choose to be in the RSP plan. We also, during the course of our deliberations, considered a narrow network and a broad network. And because of the complications to which you refer, Senator, we decided not to do that, because that would be another complication in the whole thing. But this talks about actual companies, not plans.
Companies.
Yeah, it talks about insurance companies, not plans.
Right, and so the proponents of the bill, they want choice in companies. They're not asking for choice in doctors, choice in benefits, choice in, specialists, choice in cost, but choice in companies. Because the costs are going to be dictated by the contract we enter into. The cost will be dictated, the providers will be dictated by the contract you enter into, but the choice in companies, and not choice in healthcare, really. Providers, meaning doctors, hospitals, specialists, things like that. But I guess I am very concerned, because we're talking about, I think I've called you, I'm probably was a pest in your eyes, because I called you so many times. Every time I received a complaint from a subscriber that they weren't getting the, assistance that they needed from the company, I feel like that's DOA's responsibility to make sure that we are getting what we contracted for, that whatever benefit they are entitled to, they should get, and DOA should help them get that if that's not happening. Or, if we contracted for customer service a certain way and we are not getting it, that DOA has to do its job and ensure that we get that, or there should be ramifications, I'm hoping.
Yes, and you're absolutely right, Senator. And at the beginning of this policy period, there were certain benefits that had deductibles, and we were asked to remove those deductibles. Of course, in the end, that will affect the medical loss ratio, and so it may well be that we're paying for that decision. But that was a reasonable decision to take under the circumstances.
And you're finding that to be a source of some of the complaints? I see.
Thank you, Senator Therese.
All right, then let me just conclude. Then we are looking at, Mr. Byrne, because you are the Director of Administration, so in addition to this contract, you administer all the contracts of the government of Guam. You're actually in charge of procurement, where we're supposed to be, going for value and competition. And you also are in charge of, administering the finances for all the departments, including, Medicaid and MIP. And it was not too long ago, I received a call from Tess at MIP that we are, they're ready to utilize whatever money was put towards MIP in our budget this year, that's going to be exhausted, for sure. So I was looking at the numbers we're talking about, and just, I just don't like the, I just think we have to be conscious that you're dealing with an entire island under a very, different circumstances than any one of us might be able to even figure what might happen next. But we're talking about the 26,000 employees and families and their dependents, and retirees, and their dependents. And we're also talking about 43,000 in Medicaid in February. That's in February before all the unemployment began. 43,000, 11,000 MIP, 11,000 people on Guam. That's a total of 54,000 people that the government already is trying to take care of under health insurance, plus the 26,000 employees, plus we have at least 21,000 going to apply for this unemployment program at a minimum. That means they're recently unemployed, perhaps since February, right? And that's 21,000. That's 75,000 people. If they're unemployed, I'm guessing they lost their insurance when they lost their jobs, and that really puts a burden on us. I mean, it's our role now to take care of, in addition to the 26,000, the 75,000 people in Guam who might need help to get coverage, Medicaid, MIP, whatever we can come up with if the CARES Act doesn't give us any more, or, the Congress. Thank you, Mr. Byrne. Thank you, Madam Chair.
Thank you, Senator Chulai. With that being said, thank you, Mr. Byrne, for being here. There's no other comments unless you'd like to respond to that. Are you okay?
Well, thank you,
Yes.
Speaker, for the opportunity. I'm concerned about that too. The provision of medical support to people who need it is of the ultimate importance. I guess we're fortunate that, if you don't want to look at it that way, a large proportion of the population of the island does work for the government and therefore does get health insurance. Some of the people that lost their jobs may or may not have health insurance. It just may be part of their compensation package to have it. Some didn't have it. But you're right. Certainly, during the last few weeks, DOA has been involved in areas because of the circumstances that it hasn't before, and I think everybody knows that we actually last Friday completed sending out 17,000 checks under the Program Salapi, which we did. We set up that program in a week. So, if I can say this, I'm very proud of the people that work in the department that did that. We are looking at also the MIP issue because that is a concern. Medicaid is less of a concern because that's federally supported, and now the federal support is up to 93%. So that takes a lot of the burden off. But MIP continues to be a problem, and one of the areas that certainly I think is worth considering is if we can roll MIP into this self-funded option, it might be a better way of funding the whole program. And it is something we're looking at, but we're in the very early stages. But thank you for raising that, Senator.
Thank you, Mr.
Thank you,
Byrne.
Mr. Byrne.
With that being said, colleagues, it is 12:03 right now. We will take a lunch break, come back on a motion to come back at 2. Yes, Vice Speaker, Majority Leader.
Thank you, Madam Speaker. I'd like to make a motion that we recess till 2 p.m. today.
Si Diyos mo, si With that being noted, before I ask, I will note that there are 8 amendments from 5 of my different colleagues. We will entertain that at 2 p.m., so we are in recess to 2 p.m. this afternoon.